Okay, happy Wednesday and welcome to the Utah School Mental Health Collaborative 8-part learning series. And this series is brought to you by our team here today from the UTech Lab that houses the Utah School Mental Health Collaborative. The UTech Lab is the technology and training, education and consultation lab housed within the College of Education at the University of Utah. So as usual, let's take a minute to go around and introduce the presenters today. So my name is Dr. Shaturi Alapermawood. I'm a postdoctoral fellow here at the UTech Lab.
My name is Derek Smith. I'm the staff psychologist at the UTech Lab. I work with some of our northern schools.
I'm Molly Davis. I'm a social worker in the lab and just help with supervisory and administration tasks.
And I am Jocelyn Kazer-Kodama, and I am a project development assistant.
Thank you, everyone. Thanks for being here. So first, we want to give a big shout out to the organizations and institutions. Some of this work would not have been possible without the support from our funders and also our collaborators. So we have Cambia Health Solutions, the Huntsman Mental Health Institute, ULEAD, and Utah State University. The content for today's training was developed by the Mental Health Technology Transfer Center Network, we call NHTTC, and the National Center for School Mental Health, NCSMH. So the MHTTC network hosted an 8-part learning series that used the National School Mental Health Best Practices, which is an implementation guide, guidance modules for states, for districts, and for schools. And this resource was developed by MHTTC in partnership with the National Center for School Mental Health. And their goal was to help states, districts, and schools advance comprehensive school mental health and engage in a planning process for implementation. So the primary intended audience for this series are districts, school teams, and community mental and behavioral health providers who develop and oversee some of the school mental health systems, maybe class-wide, building-wide, and school-wide. So the guidance module actually includes a trainer and a participant manual, and this includes 8 sets of slide decks for each module in the curriculum, and also talks about some of the core features of a comprehensive school mental health. If you are interested in this curriculum, I will drop a link to the chat that you can register so that you can get access to this resource. We will also send this link to you through the follow-up email after this presentation. So you can see here, these are the 8 modules that make up the implementation guide. And last month, we covered the foundations of comprehensive mental health, school mental health. And that module provided a full area of supports and services that promote positive school climate, social, emotional learning, mental health and well-being in order to reduce the prevalence and severity of mental health illnesses. So if you didn't have a chance to attend that session, you can find the recording on the Utah School Mental Health website, which also I will put in the chat. Also, you may have, if you registered for our session last month, you may have received it via an email. Okay, so today we will quickly recap school mental health teaming within schools and spend the rest of the hour opening it up for discussion to identify and explore what teaming really looks like in schools. And in the following months through May, we will review all of the other topics. So we have needs assessment and resource mapping, we have screening, the tier 1, tier 2, tier 3, funding and sustainability of some of the school mental health work that you all are doing, and also how to measure impact of that work. So before we get started, really quick disclaimer. The opinions expressed in this learning sessions are the views of the presenters and do not reflect the official position of the Department of Health and Human Services, the HHS, or SAMHSA, the MSGTC network, and the National Center for School Mental Health. There is no official support or endorsement of the HHS, SAMHSA, or the opinions described in this document is intended or should be inferred. So for a few minutes, I'm going to share some of the highlights from this module just as a refresher, but I do want to remind that the full module recording for this session is available and can be accessed through the flyer that you may have received. This module is titled School Mental Health Teaming, and really what it does, it provides an overview of the definitions of teams, the values of teams, and then kind of goes through the 10 domain indicators, almost like best practices of teaming. And then there are some resources for the most strategic planning if you want to create teams. Okay, so what is a school mental health team? And everyone probably has their own definition of what a school mental health team is, but you know, in all of those definitions, it's important to notice some key words. So I'm just going to read this off the slide and then we can follow up with some of those keywords. So a school mental health team is a team of school and community stakeholders at a school or district level. And this team meets regularly, uses database decision making, and relies on action planning to support student mental health. So some of the keywords are regularly. How often does your team meet? Database decision making. How does your team use data tracking and analysis? And action planning. How does your school or district use that data to create more action-focused plans for the future? So teaming is really dedicated to getting your comprehensive school mental health systems, organized on the same page. And that is to mean that everybody is working towards a similar goal and everyone is being very efficient with their responsibilities. So there are 4 core values of school mental health teams. And like I said before, schools and districts have so many teams. And you might be wondering, why would you need a team that's specifically focused on school mental health at the district or at the school level? There are a couple of reasons. So first, school mental health teams serve to coordinate communication, to collaborate, and also to mutually provide individual team members who might otherwise operate in isolation. It takes a village to do this kind of work. So if there's anyone who's operating in isolation, the goal is to bring them all together. School mental health teams also develop a common vision and priorities for improvement, just to ensure that the school mental health system is meeting the needs of all the students and also a larger school community. So, again, it's kind of like bringing all of that together and working towards one mission, one vision, and also like the means to achieving that vision. And finally, school mental health teams can explore how to maximize limited resources to address school mental health needs of students and also their families in a more systematic and strategic manner. Every school and school district is different when it comes to how much resources they have. And to be equitable, it makes the most sense to explore what can you do with the existing resources you have and how can you best strategize them to support the school community. So the reason that we talk about this is that school mental health teams are really important, and they are built of school and community stakeholders who, like I mentioned before, use data to focus their action plans to improve services or to improve best practices. So kind of really being action oriented. So let's take a few minutes to orient to this image here. And this, I used this image last month when I was talking about school mental health, the comprehensive school mental health, but this image also is applicable, very much applicable to teams. And this is kind of what teaming looks like. So, you know, if you look at the picture, you have almost like an inner circle. So closer to the center, you have the stakeholders who, you know, have those everyday interactions with students. So you have parents, you have school admin, you have the mental health workers in the schools, you have the teachers, right? And then as you move away from the center, you have those who may not necessarily have daily interactions with students, but are still critical players of the school mental health team. So think about community providers, right? And the reason we do this is because we know that there's benefits with having diverse team members. So all of the people who are involved in some capacity to provide the mental health and well-being for our students. So we want to bring all these diverse team members to the table, right? And everyone has their own expertise, and that helps to collaborate to support our students, right? So the more we work together as kind of like an intimate interdisciplinary team, the better outcomes that our students can receive. So teaming is really important to refine our communication and structures and kind of figure out ways that we can collaborate with people in our school building. And sometimes we have to go outside that school building. So, you know, depending on who is at the table, we have to go out to like community providers. So kind of bringing everyone into one place helps us develop a common vision and figure out what we're going to do with some of these resources that we have so that we can serve the most students in the most efficient way. Okay, so like I said, there are so many different kinds of teams within schools and also within districts, right? So they can look very different depending on where you are in the country or in a geographic region, or whether you're in the city or whether you're based in a rural location, right? But here is a list of some of the names that have been used at schools to describe their mental health teams. So, and for example, you know, it could be a school climate team for your district mental health leadership, but there's likely going to be some people who are responsible for making sure students have mental health supports, and those examples of teams dedicated to specifically mental health. And with that, I also want to mention that there are slightly different roles for teams at the school level and at the district level. And I'll talk about that a little bit more. So our district teams are really important to shaping the policies, the practices that are happening at the school level. So for example, deciding what the expectations are for interventions being provided, what data needs to be collected, and what ways our teams expected to address student needs, right? So these are some examples. So they're also often responsible for training and coaching school teams. So these are kind of like some of the things that teams at the district level will support. But then you also have teams at the school level who are responsible for kind of some other different roles. So we'll kind of talk about that in the next slide. Okay. So at the school level, this is like, you know, the school is like in the trenches, right? The school is a setting that has to provide the services. So they have to figure out what's going to happen in their building. They have to take those policies and practices that's set by the district and figure out how they can implement them. And also it's kind of like a bi-directional relationship too, so that, you know, you can give feedback to the district, like the district informs of like the tasks you're supposed to do, but then also you can give feedback to the district about whether or not the policies and practices can actually be implemented. And And if that's the case, what are some things that you need to refine so that everyone's on the same page? And I think that feedback is important because that's the only way that you can actually make movement in some of the areas and the needs that your school is experiencing. So at the district level, the district mental health teams, for example, may collect all of like the data, almost like aggregate all of the data and examine that to understand what are like some overall trends across all of the schools or groups of students across the schools. Whereas like at the school level, you try to like disaggregate that data and look at more like individualized plans and individualized students and support students at like the one-on-one level. So that's kind of like one difference. And also districts may provide the overall funding and the coaching and support for all of the schools, whereas the school is responsible for taking those funding and figuring out what kind of trainings need to occur, what kind of implementations need to occur throughout the school building. So I think overall this goes to say that both these systems need to work hand in hand, and school mental health teams need district level teams to function and vice versa as well. Okay, so now that we've kind of discussed what school mental health teams are, why they're important and their functions, we are going to move to some of the core quality indicators that you want to consider when you're evaluating and improving your current teaming structures and practices. If you don't have a team, that's okay. These are some things that you can keep in mind as you gather a team. But if you do have a team, these are some of the things to review and examine if you want to include these in your team, or maybe you are already having some of these included in your teaming structures. So I'd like to, so I've kind of separated these through these brackets that you can see. So at the top, you have multidisciplinary teams, youth and family partnership, and community partners. So think of these of either having or not having. So is your team multidisciplinary? Does your team have youth and family partnerships? Does your team have community partnerships? Then the middle section addresses all tiers, avoids duplication and promotes efficiency, best practices for meeting structure and process, delineated roles and responsibilities. So these are the things what we are hoping our teams to do. We are hoping that they address all tiers. We're hoping that they don't double dip and they avoid duplication just to promote efficiency. We know that a lot of schools experience shortages of mental health providers, so we want to try to be efficient as much as we can. And the next one is, are your schools hoping to use best practices to obtain, to kind of carry out meeting structures and processes? And is your team hoping to kind of delineate roles and responsibilities? And this kind of goes back to avoiding duplication and promoting efficiency. Then the bottom three, these are how are we going to do it, right? Or how are teams going to use data? How are teams going to use their partnerships to get the whole team to use the data? How are teams going to share data between all of like the partners? So when you are compiling teams, these are some of the things that you want to hit on. And and I know like different schools and different places, so some schools may not have all of these, some schools may have all of these, but again, schools, it's best that schools work with the resources that they already have and find a system and what indicators best works for their situation. Okay, so that was kind of like a summary of the Team 2 module. I would highly encourage you to, if you're interested in learning more, to watch the whole recording. So we're going to transition to our discussion portion. So feel free to read this question, take some time to think about it, and share what this response looks like for your school. So the first question is, to what extent does your school or district best use best practices to ensure your school mental health team was multidisciplinary or is multidisciplinary? And this question kind of hits on all of the different stakeholders that you want to bring to the table.
You know, in schools that I work with, Salt Lake District and some of the other northern districts, that there's a lot of really good effort going into this multidisciplinary approach. And some of the teams have, you know, a little bit more in the way of resources and are able to pull in psychiatry and, you know, some other additional resources like that to team with. But everybody is bringing in various stakeholders into this process, and so we see, you know, families that are participating. We see teachers. We see, and I've even talked to some teams that look to some of the other folks that you wouldn't necessarily think about as much, like janitorial staff, for example, where, you know, people who have a very, you know, eyes on in places where we may not as the rest of our team, and may have some really good input to the schools and to the mental health teams that we have. So I've seen quite a bit going on in that way in the schools that I've worked with or currently working with.
Thanks for that, Derek. And sorry, go ahead.
No, go ahead, Chat.
Sorry, Derek, I wanted to mention that you brought up a really good point about, I think, really being creative on who we include. Because, for example, you mentioned the janitorial staff, they interact with students very closely. And there are some students who feel comfortable talking to and opening up to, you know, different kinds of staff in the school. So I think, like I mentioned again, being really creative about who you want to bring to the table. And I think that can yield really good results and outcomes for like the school mental health team.
I was going to say, I think that's really awesome that the teams you've been working with have been including stakeholders like that. Unfortunately, I feel like a lot of the schools that I've been working with really just include the professionals who are siloed in the mental health sector of the district or the specific school, including like the school psychologists, the social workers, the school counselors, administrators, and maybe special education teachers. But I really think it'd be great to start seeing more community involvement, whether that's chat like how you were saying, the inclusion of outside providers across community levels, but especially I think involving families and parents.
Yeah, thanks for that, Sean. And yeah, I think working in silos, I think if you want to be sustainable, the best is to reach out. And like I mentioned, it takes a village to do this kind of work, and you don't have to work alone. So I think, and you know, when you bring everyone together, it helps to make the process more efficient. So that way, because if you have people working in silos, maybe you'll have 2 or 3 people working in silos doing the same task. So the importance of bringing everyone to the table and creating like a vision will really help efficiency for teams. And you know, school mental health providers are overwhelmed, they are short-staffed, and I think it'll really help to expand to other potential school staff that will be helpful. So thank you for those responses. I had plan some of, so just wanted to talk through about some of the best practices to creating or being or including like a multidisciplinary team. So the benefit really of having a multidisciplinary team is critical to ensure that multiple perspectives about school mental health are integrated into planning and into implementation. And to foster like a really strong team, you need to have members from all possible stakeholders, all possible backgrounds. So that way you can get all the voices at the table to make sure your team is meeting the needs of your students at various levels. So here you can see the best practice is to include diverse groups, and the best practice is that all the team members have regular attendance at the meetings, and all the members are active participants in those meetings. So some of the stakeholders that you can include here are school health and behavioral health staff, teachers, school admin, youth and parents, including them in, so I think, so for example, all of these other staff have some sort of knowledge about how school systems work, and students and families may not be so fluent with like how the school system works. So while it's important to have them at the table, it's also important to make them feel like they're active participants. So preparing them, providing them with information, and also just like following up after meetings. So these are some other important ways to make the best use of their participation, and also make them feel welcome, and also making them feel that they're important contributors to that meeting. Then you also have community health and behavioral health providers. You have child welfare, juvenile justice, and also community leaders. So this is by all means not an exhaustive list of the different groups who you can include in your school mental health teams, but this is definitely like a good place to start off. So I'm just curious to hear from the audience if you all are aware of like what do your school mental health teams include out of this list that's here?
I think at the schools that I'm working with, they include pretty much all of the components. We're trying to stay away from having to get to like juvenile justice, and keeping it more in like the education and prevention area versus the punishment and reinforcement of that. But they also are included in that, and we also call like MCOT and things like that if we have to.
Yeah, thanks for that, Molly. Yeah, so like having so kind of MCOT speaks to like a community health and behavioral health provider, right? And some schools have really close relationships with some of those providers, and I think having that like really helps them to understand the school system, what the resources are, what kind of background do the students have. So the more information that these providers have, I think the smooth the service provision will be. So yeah, thanks for that, Molly. So again, schools can get really creative as to who they include, but there are like kind of some standard stakeholders that most teams have. So you have the teachers, you have the school admin, you have some community or school health and behavioral staff. Okay. So the next question, to what extent does your school or your district use best practices to meaningfully involve students and families to plan and improve the school mental health system? So this is an extension of the previous question. So not only do you want to be multidisciplinary, but you also want to involve students and families in meaningful ways. And if your school does not currently include students and families in their teams or in their school mental health systems, what are some ways that they can do to plan and improve their participation?
I know we have some liaisons in our schools that help wherever our families can't get to the regular meetings. And so our liaisons have been very supportive in helping families meet with us on a regular basis. But we try to meet with those families on a regular basis and support their needs as much as possible. But that is hard for us in our region. And so liaisons often fill that gap for us.
Thanks, Trevor. Yeah, I think that's a perfect example of how you can be creative, right? So it's like taking the team to the parents, then bringing the parents to the team. And this, like I mentioned, you have to be really creative with what resources your school has. So I think that's like a perfect example. And you also mentioned, Trevor, like different ways of how you can include them. So, for example, if a school doesn't have resources to provide transportation to parents to bring them in to team meetings, then another way that we can do is just like take some of that team meetings to them. And also, we can use technology, but again, there are some families who don't have those resources. So I think being really mindful and intentional of like how we want to include them, but also providing the means to be included.
I think also along those lines, having teams reach out and have a presence at things like PTA meetings, and being able to chat with folks from time to time in those kinds of spaces could be really helpful.
Yes, I 100% agree, Derek. That's a really good idea, and also like another example of how you can be creative. Yeah, and also just like when it comes to scheduling meetings, that's like a good thing to keep in mind. If time allows, and if the means allow, to like schedule those meetings during or like right before a PTA or right after a PTA, so that way it's like making like achieving 2 tasks within 1 visit. So thanks for sharing that. So I just wanted to share some examples here. So some of the best practices you can see are listed on this slide. So, you want to seek caregiver or student input on their strengths and the needs, right? And students, there's no one who knows about their needs outside like the students and their families, right? I mean, teachers, school admin, school personnel definitely, do a good job learning about the student, interacting regularly, but that's just like one setting. And at the home setting, students themselves and their families know what's going on. So trying to find ways to seek input on their strengths and also their needs. And these needs can also sometimes be outside the school system. So one way that you can receive or solicit this feedback is by doing surveys, like a brief Google form. Or like like Trevor mentioned, if it's a liaison, whenever the liaison drops into these families' houses, just having like a conversation and talking about things and just kind of leaving it more open-ended. You can also do focus groups and like Derek mentioned, scheduling these focus groups during PTA when like families are obviously for the most part in the schools, just like finding a time to gather them and having some coffee or some snacks and just like having a really intentional conversation with the group. So you can also identify there are certain community providers like certain organizations within the community that are very family centered. And these are organizations that can give you some direction on how to best involve families, and also how to identify their needs. So again, kind of goes back to creativity. How do you want to include, and what are some things that you can do to achieve those? So, including families and including students in the mental health planning and in the teams needs to kind of be a common theme throughout your comprehensive school mental health planning, implementation, evaluation, quality improvement, and also sustainability. So, once you gather, like, for example, we'll speak about this in the future, once you gather your data and you interpret your data, having the voices of your families and your students speak to some of those experiences, some of the data, and connecting them with those experiences is going to be really, really helpful. And you'll find that, that goes a really long way into the future. So beyond like teens. So, some other helpful tips to keep in mind about involving students and families are kind of listed here. So, and I wanted to list this here is because you must be thinking, well, we want to include families and students, but how do we do all this? How do we have families contribute to this system? And, this list kind of shows there are a number of ways on how you can include these members into your team. We must remember that, we're working to support the needs of our students' mental health. So like I mentioned before, there's no one who knows better about these needs than the students themselves and also their families. So pretty much goes to say our families and students are their own, are experts on their own selves and their own kids. So, again, to highlight students and families can serve as a voice for other families and other students who cannot attend and who can't support. So, having some form of family member or student represent, like I mentioned on the previous slide, can help with some of like the school mental health practice buy-ins on a larger scale. So a good example would be screening and other intense mental health services. So we know that screening is just kind of like the almost not like the stigma, like the myths around screening kind of depends from families to families. So, if you're having a hard time gathering consents from families to screen their children, having this parent representative on the school mental health team kind of advocate for that can really go a long way, because if you have a parent talking to other parents about the importance of screening versus a school principal talking to parents about the importance of mental health screening, both are great, but we definitely know that, as a parent, you have more, you want to hear more about what the other parents have to say. So that's kind of like an example. And another important thing to mention is when you do include families and children in these teams, we have to be mindful to avoid some of the mental health jargon that we tend to use when we are in these meetings, and that kind of goes back to how do you want to intentionally include these people, but also how do you want to make them feel welcome, because you want to show them that you really truly value their participation. So some things that will help is to avoid some of the mental health jargon. So like MTSS would be a good one to avoid, right? And kind of like finding terms that caregivers understand, or meeting with caregivers and teaching them these things. So almost like briefing them before meetings. Following up with them, like, how did you feel about that meeting? Like, is there any other way that we can support you? And some caregivers may not feel comfortable expressing feedback during meeting. And I think teams need to work towards trying to make everyone feel welcome and comfortable. But if not, following up with caregivers and seeing if they have any feedback that they want to maybe share one-on-one with you. providing opportunities to ask questions, and also kind of creating a space, not only for parents and families, but for everyone, where they feel that they can jump in and give their perspective. So kind of all of these set the stage for everyone to be and feel like they're active participants, and not kind of playing more of like a passive role, or just listening. Okay, I have this question and another one. So to what extent does your school district use best practices to facilitate effective school community partnerships? If your school or your district does not have community partnerships, that's okay. And if that's the case, what are some ways that some of these can be facilitated for the future?
I think some people at the various schools that I work with do frequently communicate with outside therapists. If we know that some of our students are working with a therapist in the community, we have ROIs, we communicate with them. So we make sure that everyone has like the same goal and nobody is working against each other in that capacity.
Yeah, thanks for that, Molly. And that kind of goes to say, like, we don't need to work in isolation. And working in isolation can really hurt efficiency and also resources. So kind of collaborating, but making sure everyone works towards like a unified vision. Thanks for sharing that.
I know that part of our discussion in the first week of this series was around bringing in those referral services and being able to have efficient referral services to folks in the community and kind of increasing that relationship. And so I know that some schools are working on that as well. How do we make sure, and how do we do a warm handoff and those type things with community partners? So that was something that came to mind as you were asking this question.
Yeah, thanks for sharing that, Derek. And it is kind of like a best practice, right, to facilitate an effective partnership. And that's also like almost touched on like, clinical ethics, where you have to like do the warm handoff and make sure like students are served. And there's like a smooth continuation of services for students and their families. Thanks for sharing.
In a Salt Lake school that I worked in, we had ongoing partnerships, which were pretty neat because it was with community members who students would probably interact with at some point in their life. So we had the Urban Indian Center. They would come in monthly and work with Indigenous students. And then there's also a partnership with the police department in gang prevention and violence prevention. And there's a liaison who would come in and work. I don't know, she was there probably a couple of days a week, and the students loved her. So it was really great to have that kind of connection between the students and the police department, I think, especially given the demographics of the school that we were in.
Yeah, thanks for sharing that, Sean. And also, I feel like that's a creative way of including different stakeholders in your school teams, right? And like really seeing the best way to support the existing populations in the schools. And that also kind of speaks to like how you can be intentional with who you wanna partner with, and how you want students to benefit from those. Thanks for sharing that. Okay. So I just wanted to outline some best practices here. Like I mentioned in module 1, schools and districts that lead school mental health efforts, you cannot do this work alone, and you shouldn't be doing this work alone, because there are so many other people in the community who do similar things. So partnering with community providers, including health and mental health providers, can really augment like the vision and also like the efforts of the school. So some of the best practices include establishing communication mechanisms. Strong teams survive on strong communication. So you want to host team meetings. You want to frequently communicate. It can be email, it can be conference calls, it can be phone calls, texting, kind of given the need. And whatever like creative communication strategy that you decide for your school, all of these are just going to only ensure that you have effective communication between not only your school leadership team, but also your community partners. And also some community partners operate outside like a school building, so they may not always be updated on like the day-to-day things that happen in the school. So you don't want them to feel left out because they're serving a population in your school, so you want to include them. So communication is very important. And when you decide or when you initiate partnerships, creating like a memorandum of understanding or some other form of agreement. And the purpose is to like really detail the terms of the partnership, so as to say. So like, who is providing these services, what are these services, when are they being provided, where are they being provided, and how will they be provided? Meaning, for example, face-to-face or virtual. Those are just some examples. So knowing this information and setting it up beforehand not only solidifies the partnership, but also like you as a school team can communicate this information to students and their families. So the more robust information and clear information you have, the more buy-in for these services. Next, you want to ensure a full continuum of care within a multi-tiered system of support, right? So you want to make sure that these school and community partnerships address all of the levels, and everyone's working together. And this, to maximize really the support that they can provide. So, one common way that schools utilize community providers is more along the lines of providing kind of the intense mental health, the one-on-ones, the crisis supports. But if you want to think outside the box and be really creative, you want to see how you can expand the services offered by the community partnership into like the tier 1s or the tier 2s. Kind of goes back to like how we want to maximize the support. And the last one is data sharing agreement. So community partners are outside providers. So thinking about like some of staying within the regulations of HIPAA and FERPA guidelines, you wanna find out the best way to share data, and you wanna have data sharing agreements that not only allows you to share data, but also like access some of the information that's needed to provide support and services to students. Okay. So these are just kind of from the previous slide, some ways that you can facilitate effective communications. So some of the helpful tips is to develop a wish list. So in a perfect world, if you had 5 community let's say 1 community provider who wants to support and partner up with your school, what are some of the ways that you want them to support you? And one way to do this is to create a wish list. And here on the second slide, on the bottom right, you can see an example of a wish list that a school came up with. So maybe the provider, the external provider, community provider can support with all of these. Maybe they can support with some of these. So, but either way, I think it's good to have a wish list put together and keep it in your back pocket. So as to say, if someone wants to partner up, you already have this ready to go. Okay. So this is our last question. To what extent does your school to what extent does your school district use best practices to ensure teaming structures address each tier of your multi-tiered system of support. So this question really addresses the shortage, like concerns with shortage of providers. So, you know, when you ensure teaming structures, that really helps to avoid duplication of roles and also increase efficiency. So when you think of this question, consider the number of teams that you have for your district or for your school. Because some schools may decide to have one universal team for all of the MTSS levels. Some may decide to have a tier 1 team, and then tier 2 and tier 3 teams together. So many schools have different ways of arranging these teaming structures. So in your schools, what do some of these look like?
I do see a lot of the kind of combined team where it's like one team that looks at all of these areas. I can see the value of having. I'm thinking about schools that do have more limited resources around mental health supports within the school. And I like that wish list you had on the previous slide, looking at like maybe having some of the community partnerships take on maybe those tier 2, tier 3 services, and you know, how can we team with them in that part? And so have the team be not only internal to the school, but also incorporating some of those individuals as well. And then I think the beauty of the multi-tiered system is that anybody can kind of get off the ground with a tier 1 level of support within the schools, because we can all provide that. We can get curriculum materials and things that teachers can present, that we can present as a school-wide assembly, those kinds of things. So that's really nice for that. And then it's just kind of figuring out how do we extend to the tier 2 and the tier 3 levels with some of these teaming processes and these community partnerships that we talked about previously.
Yeah, thank you for sharing that, Derek. And, you know, reflecting on what you mentioned, it kind of goes to say like different schools are in different places, and the number of teams and the teaming structures probably really depend on the resources that your schools have. So if a school maybe feels that their providers are limited, then I could see how they may have one team to address all of the tiers, versus if there were like multiple service providers, then they can kind of expand. So this is also where you want to bring in like teachers who may be interested in mental health work. You have, like I mentioned, again, you can include parents. So I think, again, goes back to how you want to be creative with kind of the structuring of these. So these are, again, I just wanted to mention some best practices to ensure teaming structures. You know, so because like as discussed in module 1, a comprehensive school mental health system will include promotion, prevention, and intervention. So when you are kind of thinking about teaming structures, those are some things you want to think about, like where do you want to focus on? Promote, prevent, or intervene with the available resources that we have. If we want to focus on all 3, so how do we kind of adjust with what we have? So teaming structures, again, vary based on the school, the district, the resources they have, the size, the staffing, and also your priorities, your vision, right? So I think what's important is it's not just about coverage of all tiers, but also how well those teams and individuals are communicating. And that there's logic for students moving up and down, moving through the tiers based on the strengths, based on the needs, and the progress that they make over time in the different areas that that their needs exist. So I just wanted to kind of provide some of the best practices and also some of the considerations, like I mentioned before, the resources, part-time staff, and how many students are currently in each of those tiers. So I just wanted to provide some of that. And these are some things to think about as you are thinking about, your current team, or if you're thinking about restructuring your team and how you want to do that. So there's ample resources that you can access on the MSGT website, which we will send you a follow-up email with all of those resources. And we are at the top of the hour. So thank you for attending the module 2, 8-part learning series today. So if you have any questions, feel free to reach out to or respond to the email that you have received if you registered. But more information on the 8-part learning series can be found on our Utah School Mental Health website. So if you are interested in learning more, please do visit that website. But we will see you all again next month, and look forward to receiving the recording of today's presentation with more information for next month's presentation. So you all have a great rest of your Wednesday.